children have human rights in the same way as adults have human rights, and one of those is that they have a right to be heard in relation to everything that's important to them. So they have a right to be listened to in relation to their own healthcare. They have a right to be involved in contributing to designing and feeding back and responding to how services are designed. They want to be involved. There's a lot of research which shows that when you ask children what's going wrong in their lives, not being listened to, not being respected, not being taken seriously is a huge barrier to their self-respect, self-esteem and their sense of overall wellness. So my plea really to the audience here is to say children do have capacities. They have more capacities than you probably think, that the experience of being involved in their decision making around their lives strengthens those capacities, but you will also benefit from engaging with children more effectively, because you'll get better health outcomes, better well-being outcomes, and children will be better able to contribute to and understand their own healthcare needs. Well, there are lots and lots of methods. I would talk about at the individual clinical level. Create space so that children can ask questions, give children enough information so they know what's happening, so that they can make informed choices. They can ask questions about what's happening, why it's happening, when it's happening, and create a space so that it feels legitimate and okay for children to ask those questions. So at a clinical level, and then respond positively to what children are saying. You can't always do everything that children want. Clearly that's not possible, but take them seriously, listen and respect, and let them know what's happening and why you can't necessarily do what they want, so that they're properly informed and feel they've been included and taken seriously. But then at the broader level, at the level of the clinic or the hospital or even the doctor's surgery, consult with children, involve children, set up youth councils, set up forums, set up complaints mechanisms, set up consultative groups so that children can give you feedback on how services feel from their end as the recipient of those services, what's important to them, what they'd like to see change. Provide proper information about confidentiality policies. Make sure that children have a part to play in the way services are delivered and designed, but also, where those services are placed, thinking about issues of confidentiality and so on. But also finally, to think about how you engage clinicians in listening to children and then acting on what children are saying at the public policy level. So becoming advocates for children at the wider level, listening to what they're saying and then looking at trying to address the root causes of some of the problems that they face in relation to their own health care.